So the craniofacial program at Oishei is a team of providers dedicated to treating patients with craniofacial conditions. Some examples of those include cleft lip and palate, craniosynostosis, facial reconstruction cases, and airway obstruction. It is located at the only freestanding children's hospital in New York State. We are all specially trained in treating patients with craniofacial conditions.
The Laurence C. Wright Craniofacial Center was formed years ago, started by Dr. Perry, amongst others, to really join in the mission of team care for patients with cleft and craniofacial problems. And so it's developed over the years to adding a multidisciplinary team of otolaryngologists, speech pathologists, nurse practitioners, social workers, oral maxillofacial surgeons, craniofacial surgeons, with the goal of really providing the standard of care, which is team care for these patients.
One thing unique about Oishei Children's Hospital is that we offer all surgical options to all families, which suits the families better. Having a multidisciplinary care center right in one area where patients can come and have all their needs addressed lessens the burden on the families, as well as keeps all communication within one institution close by. We offer all different treatment modalities, including minimally invasive, and that is a treatment that is, we're one of the only centers in Western New York that offer that care.
It's really important to have a collaborative, multifaceted clinic to help these patients through their journey. Craniofacial conditions affect both the face and the skull, but they can affect other things too, like the airway, the health of the brain, the health of the eyes. So having a whole team that helps to manage the patients and the condition's side effects is really valuable to the patient, but helpful to us as the providers that are part of that clinic. And we always come together and discuss that patient's unique condition, their unique findings on their imaging, and what we think is going to be the best option for them to get the best results. And so it really is the culmination of everybody's expertise and what we think is going to be best for that patient coming together from all our different perspectives.
We try to make it as painless as possible for them and for the parents. So starting at birth, or sometimes even before birth with a prenatal ultrasound, they'll identify a cleft or a facial anomaly. And from that point, we can really get all the specialties involved and hopefully, first and foremost, put the parents at ease and describe to them the steps ahead of what's going to be needed for the care of their child. And then once the child's born, or if it's identified after birth, we can really get all the specialties involved. We communicate all day, every day together, weekends, nights often too, about these children because they require such a multitude of multidisciplinary care. And so we definitely have to check all the boxes and not miss anything. The child, especially once they hit adolescence and the teenage years, there's social settings and there's being teased maybe. So we have a psychologist and a neuropsychologist on our team that can help address those concerns because it's really the child's well-being and cognitive development and mental status that is the most challenging part of the process. So we have members on our team to help address that.